COVID infections are on the rise in Florida, with a summer wave of the virus variant hitting the state. The increase in cases, while notable, is modest compared to past trends. Florida is one of 39 states experiencing a rise in COVID infections, as per the U.S. Centers for Disease Control and Prevention, CDC. The CDC, which no longer tracks individual cases, relies on ER visits, hospitalizations, and wastewater data to assess the COVID situation. Although influenza and RSV levels remain low, COVID infections are increasing, with South Florida hospitals reporting more patients testing positive, though not to the extent of previous summers. Dr. Paul Eckert, Chief of Infectious Diseases at Memorial Healthcare System in southern Broward County, noted a slight increase in COVID-positive hospitalizations and ER visits. The most dominant variant in the U.S. is KP.3, accounting for approximately 33% of cases, followed by KP.2 at about 21%. Scientists are also closely monitoring Pound.1, which is accelerating and could soon overtake its counterparts. All three variants are descendants of Omicron and offshoots of JN.1, which was responsible for many of the country's winter infections. Seniors aged 65 and older and immunocompromised individuals remain the most at risk for severe COVID infections. CDC spokesperson David Daigle stated that there is currently no evidence suggesting that KP.3 or Pound.1 cause more severe disease. The CDC continues to track variants and assess their public health impact. While COVID vaccines still offer some protection, studies indicate that existing shots are less effective against the current variants. New vaccines are expected to roll out in the fall, with the FDA recommending updates to vaccine formulas to better match JN.1 and its descendants, like KP.2 and KP.3. The new shots are being developed similarly to annual flu vaccines to improve efficacy against circulating variants. COVID-related ER visits in the U.S. have increased, with a 25% rise in hospitalizations from May 26 to June 1, according to the latest CDC data. In Florida, state health data show a rise in positive COVID tests since late May, particularly in Miami-Dade and Broward counties. Despite the uptick, Florida hospitals are not experiencing the overwhelming numbers seen in previous surges. At Jackson Health System, Miami-Dade's public hospital system, there was an all-time low in inpatient cases during April and May, followed by a slight increase in June. Memorial Healthcare System in Broward also reported a 38% increase in inpatient COVID cases since the end of May. The summer heat likely encourages people to stay indoors, facilitating virus transmission. Additionally, increased travel during the summer season may contribute to the rise in cases. As people plan for the July 4th holiday, Dr. Eckert emphasizes the importance of taking key precautions to reduce the risk of COVID spread.